Binduraj with us to discuss a very important topic today. India is known as a diabetes capital, and there's huge burden of diabetes in our country. With this big problem, there is a bigger problem of lot of misconception and myths about diabetes. Diabetes ಬಗ್ಗೆ ತುಂಬಾ ತಪ್ಪ ಅಭಿಪ್ರಾಯ ತಪ್ಪ ಕಲ್ಪನೆಗಳಿವೆ. ಸೊ ಅದನ್ನ ಸರಿಪಡಿಸಕ್ಕೆ ಟು ಗೆಟ್ ದ ರೈಟ್ ಇನ್ಫಾರ್ಮೇಶನ್ ಫಾರ್ ರೈಟ್ ಟ್ರೀಟ್ಮೆಂಟ್ we have with us Dr. Binduraj. I'll welcome sir again for this
Thank you.
Facebook live. uh, Sir, everybody knows about diabetes, but I'm sure you also face in your daily practice lot of uh, questions from patients, lot of misconceptions, lot of things which is told on internet, on Instagram, that do this, do that, and all of us are influenced by social media, and many
True.
people do get influenced very to a large extent, and that may affect their treatment. So to set the record straight, we want to hear from you what is right and what is wrong, what is correct and what is myth in diabetes. So I'll
Sure.
just ask you a few questions, I think,
Yeah.
and
Correct.
in this way we will try to clear this misconception and myths. So the first question I want to ask you is uh, very simple question: is diabetes caused only by eating too much sugar? So if I stop my sugar, my diabetes will go. Is that right?
No, it's absolutely wrong. The thing with diabetes is the insulin resistance. So it's nothing to do with the absolute sugars intake. Okay, so whatever food we take, ನಾವು ಊಟ ಏನು ಮಾಡ್ತೀವಿ ಎಲ್ಲದರಲ್ಲೂ ಶುಗರ್ ಕಾಂಪೊನೆಂಟ್ ಇದ್ದೇ ಇದೆ. ಸೊ ಹಂಗಂತ ನೀವು ಫುಲ್ ಎಲ್ಲ ಊಟ ಬಿಟ್ಟು ಉಪವಾಸ ಇರೋಕ್ಕಾಗೋದಿಲ್ಲ. Okay, and that's the one thing. The next thing is the insulin, what I was talking about, insulin resistance. The insulin resistance means the amount of insulin which is being secreted to bring down the sugars or metabolize the sugars is not sufficient, or is unable to do its work completely. So stopping sugars will not solve the problem. The basic problem is insulin resistance, and it happens for a very long duration. It doesn't happen overnight. So it starts from the childhood days, and gradually it builds up, and when it reaches adulthood, so the terminal event is diabetes.
Okay, sir,
So
understood.
food habits in the childhood, especially nowadays, what we see is they have access to Pepsi, Coca-Cola, chips, burgers, fries, but they don't have good nutritious diet. So at that point of time, nobody realizes what will be long-term impact of this type of diet. So I have seen a lot of patients like this. Even the people who are very poor, they have access to this type of food. So this is what is leading to the burden of diabetes in India.
So ultra processed food is the
Correct.
culprit
Culprit,
for
yeah.
a long
The
period of time.
refined foods, ultra processed foods is a major culprit which is causing this diabetes.
Yeah. So the first thing is, as sir said, it's not just sugar; it is ultra processed food, which is actually the main culprit. And over a prolonged period of time, and diabetes is only the tip of the iceberg. The
Correct.
underlying problem has been there from a long period of time.
Yes, yes.
Right, sir. Thank you, sir. Just let's move on to our next question. Many times we find that patients come with very severe complications of diabetes, and they say that "ನನ್ಗೆ ಮುಂಚೆ ಏನೂ ಇರ್ಲಿಲ್ಲ, I had no symptoms." So, is it possible that somebody can have diabetes without any symptoms, or they will have some early symptoms or warnings for diabetes?
Yeah, this is a good question. The thing with diabetes is most of the time it doesn't have any symptoms. So it's been picked up as a just because routine they went in for some routine investigations, or they have approached the doctor for some other illness. ಬೇರೆ ಏನೋ ಕಾಯಿಲೆ ತೋರಿಸ್ಕೊಳಕ್ಕೆ ಹೋಗ್ತಾರೆ. ಸೊ ಡಾಕ್ಟರ್ ಸಸ್ಪೆಕ್ಟ್ ಮಾಡಿ ಒಂದ್ಸರಿ ಶುಗರ್ ಚೆಕ್ ಮಾಡೋಣ ಅಂತ ಹೇಳ್ತಾರೆ. ಸೊ ದೆನ್ ವೆನ್ ಇಟ್ಸ್ ಗೆಟ್ಸ್ picked up. The other thing is some people have that symptoms, usually polyuria. They just neglect telling that hey, ಚಳಿಗಾಲ ಇದೆ, ಸೊ ಯೂರಿನ್ ಜಾಸ್ತಿ ಹೋಗ್ತಾ ಇದೆ, ಬೇಸಿಗೆಗಾಲ ಇದೆ, ಬಾಯಾರಿಕೆ ಜಾಸ್ತಿ ಇದೆ. So just neglect the early symptoms. And another thing is what you were talking about, the complications. They don't happen overnight. So because long, especially in type 2 diabetes, we have not introduced in the type 1 or type 2. Type 1 ಅಂತಂದ್ರೆ is younger onset, and they require insulin for treatment. Type 2 ಅಂತಂದ್ರೆ it's later onset and it can be managed with medicines and diet. So type 2 ನಲ್ಲಿ usually they don't have much symptoms. what we are talking about. Type 1, there are a lot of symptoms, they land up with complications during the diagnosis. They come with diabetic ketoacidosis, or severe septic complications or infectious complications. That's where we pick up type 1 diabetes. Type 2 is usually the asymptomatic, or they are diagnosed by some other conditions. We pick up diabetes. And the complications in type 2 diabetes, they gradually come in if you're not treated completely or adequately treated. Diabetes means HbA1c should be at 6.5 to 7.5 strictly throughout his life from the time of diagnosis. It should be well controlled. Any point of time, the HbA1c or sugars are not well controlled, they tend to land up with complications, especially the renal complications and eye complications. So that's why we have tests to detect early. Means all of them should be in regular touch with their physician, and they will advise a test. Don't think that they are ordering just a test to get money. So it means mainly it's for your health, to pick up the complications early, like urine microalbumin, creatinine ratio, fundus examination every yearly, echo and treadmill test to detect early cardiac conditions. So there are some tests which we can pick up the complications with early, and you have medicines now to reverse these things. So that's where we need to pick up these cases early.
Perfect, sir. So I think the take home is type 1 diabetes can present with complications, but type 2 diabetes can be asymptomatic and has complications for a long period of time. So if you have complications, that means you had diabetes from a long period of type 2 diabetes from a long period of time. And with the availability of so many newer medicines and effective treatment now, it's important that we diagnose early and
Correct.
prevent complications.
Correct, correct. Because I have seen many patients who have been on OHS for a long time and they are doing fine. Major misconcept in this condition is their sugars are FBS and PPVS is normal, so everything is normal. The problem with that FBS and PPVS is we are not checking the sugars in the other part of the day, afternoon, evening, night. We are not checking the HbA1c is the one which picks up these conditions. So usually what happens, patients 2 to 3 days before getting checked, they control their diet strictly. They come and get it checked. So it will come back normal. So HbA1c doesn't do like that. It reflects 2 to 3 months of average sugars. So that's the one thing. And another thing is, many people have misconception that creatinine is normal, so kidneys are normal. No, once the creat becomes abnormal, the kidneys are damaged beyond repair. So we need to get urine microalbumin or albumin creatinine ratio. That's the initial insult to the kidneys because of long-standing uncontrolled diabetes. So once that is picked up and we give treatment for them with the newer medicines, it can be reversed.
Perfect, sir. Sir, nobody in my family has diabetes. So does that mean that I will not get diabetes? Or the other way around, if somebody has diabetes in family, does that mean that they will always get diabetes?
Now, this is another good question because most of the patients come like this. Usually because this urbanization, what we see. So it's a major is a factor is a lifestyle. So everyone tells, I don't eat sugars, I don't take carbohydrates, but still I have diabetes. In my family members, none of them are diabetic. How come I have diabetes? And the same other way around, my father is diabetic, my grandfather is diabetic, my mother and everyone is diabetic. Will I get diabetes? Yes, in this scenario, yes, you are more likely to get diabetes if your lifestyle is not good. And the trend what we are seeing from 20, 30 years in India is the subsequent generation have a earlier onset of diabetes if their family has the diabetes history. The earlier in the sense when 10 to 15 years earlier. Okay, so major factor is a lifestyle because diabetes is a lifestyle disease. So this occurs for a long period of very bad lifestyle management. Everyone tells, I don't have any stressful job. But when you're driving a vehicle, it's a stressful thing. Very simple. When you drive vehicle, you drive for 30 minutes, you are exhausted, you feel tired. Appa, ಏನಪ್ಪ ಇಷ್ಟೊಂದು ಓಡಿಸಿ ಸಾಕಾಯ್ತು. So that means your body is not uh, enjoying your drive. Your your body is suffering because of the drive. Okay. So another thing is sleep pattern. The lifestyle, what we are talking is the lifestyle, sleep pattern. Most of the time people sleep at 11, 12, and they have food at 9 o'clock, 10 o'clock. So this again, it's contributing to the diabetes, because the reduced sleep again is a stress for the body. Having food in our 9:30, 10 o'clock, again it's a stress for the body. What I'm talking is for preventive things, not who already have diabetes. And we are talking about the risk factors or the lifestyle issues leading to diabetes. So lifestyle is a cornerstone to manage diabetes or the outcome later. The family history definitely contributes.
Yes, so take home is lifestyle is the main thing, irrespective of family history. If you have family history, chances are more, but if your lifestyle is not good, then chances are definitely again increased.
Yes. Right.
Perfect, sir. So, next question again with regard to diet, because when diabetes is there, the question on diet
Yeah.
is always going to be
Correct.
there.
Correct. Correct.
Do people with diabetes have to completely stop eating certain fruits, certain sweets, or all sweets? What is the how should their diet be? This is just a starting question for you. But
Correct.
overall, what is the diet going to be for diabetic
Yeah.
patients?
The diet is a cornerstone for diabetes management, not the only thing. Because
Hmm.
most of the patients are of the concept that if I change my diet, then diabetes will go, or I can manage
Hmm.
my diabetes with only diet. So these two
Hmm.
both concepts are wrong. Diet is
Hmm.
one part of management of diabetes. The other part is exercise. The next part is medicines. So these two combined with exercise and diet, how much the patient can manage these two parts, the medicines will be decided. The
Hmm.
patient is unable to manage the diet completely, yeah, medicines will go up. Is unable to do exercises, the medicines will go up. So entirely depending on medicines is wrong. Entirely
Hmm.
depending on diet and exercise is also wrong. All three should go hand in hand. Depending on how much of contribution you can do, the medicines will be decided. So that's one thing. Like coming to a diet per se. So especially in India, especially South India, what we are seeing, there's more of carbohydrate rich diet. Okay, and all cereals or whatever food you take,
Hmm.
generally, except for the fruits and vegetables, everything has glucose in them. So if you go for roti, wheat, jowar, bajra, millets, whatever it is, they have 50 to 60% of carbohydrate in them. So eliminating entirely carbohydrate or just shifting to only fruits doesn't manage anything, because the body needs energy, and maximum energy comes from carbohydrate. So eliminating completely carbohydrate is also wrong. So body needs 50 to 60% of energy from carbohydrates, 30% from proteins, and 10% from the fat. This should be the distribution. Okay, so the food which should be definitely avoided is potato, starch containing foods, potato, sweet potato. Okay, and most of the some people tell roots also to be avoided. That this is somewhat debatable thing. Okay, so and fruits, again the fruit, the misconcept is it contains a lot of sugars. The problem with it is it most of the time it is fructose. Okay, so fruits have fructose, and fructose, too much of fructose again leads to dyslipidemia, means cholesterol problems. So it should be under moderation. The fruits which have more glucose in them should be avoided, like watermelon, muskmelon, then your what do you call this, chico.
Hmm.
So these things should be, and jackfruit, we completely avoid it. But these are all seasonal fruits. But if you want to have them, but you have to balance your diet on those days. So if you
Hmm.
want to have this diet, fruits, you can have it, but cut down on the carbohydrate entirely, correct, especially the rice. Cut down on the rice portion when you're having these fruits on those days. And the other thing is your all your ultra refined food products. Everything is a nil. No, 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 no.
Hmm. Perfect, sir. So, the take home what I could understand obviously is that you can have most of the fruits, but you'll have to adjust it accordingly. So, if you are having certain fruits, probably you'll have to cut down on certain rice so that a carbohydrate intake is still maintained.
Correct.
You have complete good proportion of the foods. You should have a balanced diet, That is also important. So just an extension of this diet question. Now many people also claim that with intermittent fasting I have reversed my diabetes. Is it possible? Is it advisable? Is it for everybody?
Ah, this is another good question. The term that reversal of diabetes is entirely wrong. The better terminology is remission.
Remission.
Remission is a term to be used. The reversal of diabetes is especially when patients are pre-diabetic. The HbA1c is somewhere around 5.6 to 6.5 range,
Hmm.
and they're obese.
Hmm.
So those people, they can undergo this intermittent fasting, but under
Hmm.
supervision.
Hmm.
Because what I've seen, what I have encountered in my personal practices, patients have undergone this intermittent fasting, and they're landed with protein energy malnutrition.
Hmm.
So this shouldn't happen. Again,
Hmm.
this is an adverse effect for diabetes. Again, they can land up with a full-blown diabetes. So
Hmm.
under supervision with proper balanced nutritious diet, they can go for intermittent fasting.
Hmm.
And how long you can do this fasting?
Hmm.
Only till then the diabetes will be under remission. The moment you discontinue that dietary habit or exercise, whatever it is,
Hmm.
it comes back.
Hmm. Hmm.
So there is no reversal, only remission. The moment you stop your intense diet program or your exercise program, it comes back, because the
Hmm.
basic pathology is insulin resistance. We are
Hmm.
not addressing that issue with the diet.
Hmm.
Okay,
Okay.
for the insulin resistance, they should the other thing of the other part of the insulin resistance is the protein muscle mass.
Hmm.
The protein in the body is the muscles. When there are no muscles or protein, in sugars will go up, because there is no way for the insulin to work and store the glucose into glycogen.
Hmm.
So
Hmm.
again, the sugar goes up.
Hmm.
So extreme is also bad. So always it's a balanced nutrition, and this diet practice should start from childhood, not from
Hmm.
30 years, 35 years, 40 years. From
Hmm.
childhood, the children should be taught about proper dietary habits and practices and exercises.
Hmm.
Only then we can get down on this what we call as epidemic of diabetes.
Hmm. So the take-home message obviously is diabetes reversible is a misnomer. It should be remission.
Correct.
But it is again those sort of dietary changes are not sustainable, and as you stop, suddenly it's going to go up. So you have to have something sustainable plan, and it should be under supervision.
Correct.
So as an extension, again, many people say, "Sir, ನಾನು ಸಕ್ಕರೆ ತಗೊಳಲ್ಲ, ಬೆಲ್ಲ, honey
Correct.
ತಗೋತೀನಿ." Is it better for than sugar for diabetics? Jaggery and honey, jaggery or honey.
Okay. So sugar comes from jaggery. So the plus point with jaggery is that it has some amount of nutrition, like in terms of iron, sulfur,
Mm,
those things.
mm,
Otherwise, it's not recommended.
mm,
Both are equal. Coming to honey, again the same thing is a fructose.
mm,
So honey is not a thing to be completely avoided. And again, too much is too bad. Too much of honey, too much of fructose. Again, it leads to dyslipidemia.
mm,
So usually nobody takes so much of honey. 1 or 2 teaspoons per day is good.
mm,
Okay, so sugar and your good, that means your jaggery, both are
mm,
equally bad.
mm, mm. So the jaggery and honey is not better than, or maybe somewhat
Honey is okay. Honey is more of
okay,
fructose. It can be consumed per daily on basis. You can consume 1 to 2 teaspoons per day. You
but you
can take.
cannot completely replace
Yeah, yeah.
sugar. Yes.
But avoid sugars and your jaggery, definitely. No.
Hmm. Hmm. So moving on, changing gears from diet to treatment. There is a lot of thing in patient mind. I'm sure when you start patients on insulin, the first question is it going to be lifelong? Can once I start, can it ever be stopped? Uh, what is the answer for that, sir?
Okay. The regarding insulin, see what is the basic pathology is insulin resistance. So the how we treat, if you are treating with like thyroid disorders, if there's hypothyroid, you give thyroxine. That's an again a hormone. For diabetes, insulin resistance, you give insulin. You give more insulin. Actually, that is the treatment. And any medicine we give, tablets, all work through insulin.
Hmm.
The method of working is different.
Hmm.
The only thing people are afraid is a prick.
Hmm.
That's the one which is bothering them. Okay, so insulin is not a permanent thing, especially for type 2. Type 1, it's a permanent. There is
Hmm.
no other medicines for type 1 diabetes. For
Hmm.
type 2, insulin is the type 2, we use it only during conditions of like severe acidosis,
Hmm.
sepsis,
Hmm.
acute infections, or
Hmm.
patient is admitted in a hospital for surgery or any other acute conditions where he
Hmm.
can't take orally or we don't know how much he takes. There are a lot of
Hmm.
fluctuations, sugars. And again,
Hmm.
it's a temporary thing till we tide over the crisis.
Hmm.
And again, always we can switch over to tablets.
Hmm.
That's one scenario. The another scenario where we use insulin is secondary sulfonylurea failure, means
Hmm.
where the tablets stop working.
Hmm.
Okay, so after 10 years, usually 8 to 10 years is the way the tablets works very well for type 2 diabetic patients
Hmm.
because they work on insulin reserves. Means again, these tablets work by producing more insulin, which is already there in the pancreas. So they squeeze the pancreas, the beta cells to produce more insulin and it works. So those conditions where after 10 to 15 years they don't work, those medicines don't work. So that's where we switch over to insulin. And even in such scenarios, we can give a trial of 3 to 6 months of insulin where the beta cell reserve can regenerate. We are giving a rest to the beta cells by giving exogenous insulin. And we can give a trial of again switching over to OHS whether the patient has regenerated a beta cells. So actually, insulin is the treatment of choice because the acceptance is not always the first choice.
Okay, sir. So the take home again is for type 1, insulin is the treatment of choice. For type 2, in certain conditions like hospitalization, infection, insulin can be used. But if medications fail, then insulin is the go-to medicine. Uh, Sir, just one more thing which keeps always keep coming up. Patients, I'm sure you would have come across that. Sir, ಅದು ಆಯುರ್ವೇದಿಕ್ ಹೋಮಿಯೋಪತಿಕ್ ಅಥವಾ ಹರ್ಬಲ್ ಮೆಡಿಸಿನ್ ತಗೋತಾ ಇದ್ದೀನಿ. I'm not taking any other modern medications. And they are like I'm controlling my diabetes through this. So, do you feel that is enough to control diabetes? Would help? What is the plus and minus with this strategy?
So we are allopathic doctors. So it's better we stick on to our scientific data and promote modern medicine. So it's not a right way to ask them to continue the homeopathy or Ayurvedic medicines with our medicines, whatsoever it is. So because we have scientific data backing, it tells these are the medicines which work and these are the side of. Another thing we'll clarify here. We know our medicines, how they work, and what are side effects also. So we can monitor for both the effect as well as side effects, and we can encourage the patient. These are the plus and minus of our medicines. Which one we'd like to choose? Because we have a wide basket of medicines right now. So, and again, treatment is individualized. Not every patient will be on the same medicines. Depending upon the patient's profile, their work profile, their body habitus, their eating habit, we can modify or tailor the medicines. And we know the side effects. So, best we offer the medicines which we know and we have scientific data for that.
Perfect, sir. I think more as modern medicine, we are very transparent in what we use, how it
Correct.
acts, what are the effects, what are the side effects. We are not, everything is out in the open, and
Yes.
it is repeatable. We know that this is what is expected, this is what the
Correct.
outcomes are going to be,
Correct.
and we work by that principle. And compared to the other alternative therapies where it may be very heterogeneous, what they use, what is done, what is not done, it's very difficult
Correct.
to say. And it's not that none of these are having any don't have any side effects. I'm sure you also would have come across a lot
Yes.
of adverse events. uh, Moving on to sir, about exercise.
Mm.
Now, patients with diabetics, obviously we discuss about the diet and a lot of questions about diet. Exercise, what should be the way forward? Is walking enough? Should they do gym compulsorily, or any other activity which is useful for diabetes control?
Yeah, the main aim of exercises in diabetics is to reduce the insulin resistance. So the most common thing we advise is walking,
Hmm.
but walking per se is not sufficient.
Hmm.
Because what is easily to be done is walking. So we advise walking for everyone.
Hmm.
Ideally, the exercise physiology of the body is when you start doing one new exercise. For example, for December, I start doing jogging. So you start losing calories, and after 1 month, the second month, the amount of calories burnt with the same exercise reduces. For example, if you are jogging for 30 minutes and you're burning 100 calories in December, the same thing in January it comes down to 50 calories. So again, you're not burning the exact amount of calories what is expected, but your food intake remains the same. So
Hmm.
again, you're accumulating calories. So the best thing is keep rotating the type of exercises. If 1 month if you're doing jogging, the second month should be swimming, or next third month will be cycling. Any exercise, but keep alternating the exercise. Don't allow the body to get accustomed to the exercise. The body is built to conserve energy. So that's the basic physiology of the human body or any body. Conserve energy and produce more. So maximum output with less energy. So if you continue to consume same amount of energy, food intake, and you are exercising the same thing, after 3 months, the amount of calorie burnt reduces. So this is a basic concept. So if you keep rotating or alternating the exercise, the body doesn't, you're not allowing the body to acclimatize. That's one thing. And the aerobic exercise means the muscle buildings, because we need protein. Muscles are proteins. That's where the insulin starts working. So we need an insulin resistance comes down. We can do some 2 to 3 kgs of lifting weight, treadmill, cross training, so planks. So these are the ones which will help in building the muscle mass and reducing the insulin resistance.
Perfect, sir. I think the very interesting point you made, that you have to probably keep rotating your exercises, not get used body used to this particular exercise, so that the amount of calories burnt is maintained. And obviously, muscle building, muscle exercise, weight training also can be done. Even WHO recommends for all of us at least 5 days a week, 30
Correct.
minutes per day aerobic exercise, and at least 2 days some of weight training has to be done
Correct.
for everybody.
Yes.
So we are running out of time, sir. We have quickly one question, two questions, last two questions. Does everyone with diabetes eventually develop serious complications?
Not exactly. But the duration of diabetes is the one which matters.
Hmm.
The duration of the diabetes, because we have seen patients living up to almost 30 years or 40 years of diabetes
Hmm. Hmm.
without any complications.
Hmm.
But at the same time, if they are living 40 years with diabetes, means their average age would be around 75.
Hmm.
So the amount of exercise they do, or means the cardiac work, will be very less. So if you do an angio, they will definitely have some blockages.
Hmm.
So it's usually asymptomatic.
Hmm.
So the duration of diabetes and the amount of good control you have, for how long you have had that good control of diabetes, that matters.
Perfect, sir. So last question before we take up a few audience questions. What are the three most important things people should remember to control diabetes?
One is your diet, means it
Yes, sir.
should be a balanced diet, small frequent meals, reduce carbohydrate, more fibers, and maintain the protein component of the food. Don't reduce the protein component. Okay, and it means your refined sugars, ultra processed foods should be out of your diet. And
Perfect.
most important thing in diet is your whatever we prescribe diet, whatever the physician, your physician prescribes the diet, it cannot be followed entirely very long term. 100% is highly impossible. Even if we try, we can do it for a couple of months and then we'll give away. Oh, ಪಾಗಲ್ಲಪ್ಪ ನನಗೆ ಸಾಕಾಯ್ತು. So that should not be the scenario. We need to sustain for a long duration. So at least 75 to 80% of the diet prescription should be followed in a month. So in a month, 30 days, at least 25 days should be okay. 5 days, okay, fine. So this is one diet. Then the exercise. So exercise. We have discussed aerobics as well as, and exercise not necessarily only 5 days, 7 days also week also good. But keep exercising, be active, be mobile, and reduce your stress. Have a good sleep. Okay. Third one is the drugs. and correct follow up with your physician. That's enough.
Perfect, sir. So I think we'll just take up one or two questions. Sir, any new developments in treatment or diabetes research? I think we'll end this with this.
Not much new in the sense is we have got some weekly dosing of medicines which are help in weight loss also. So
Yes.
apart from that, there's not much of development. Again, that's the only thing, newer thing.
Perfect, sir. I think we'll end with this. Thank you, everyone, for joining us on Facebook Live today. And thank you especially to Dr. Bindraj, sir, for clearing all the doubts and myths about diabetes. I hope you uh, are wiser after this program. I definitely enjoyed talking to Dr. Bindraj. Thank you, sir. Thank you once again. And
Thank you,
thank you all.
Vikram. Thank you,
Thank you.
Optima, for this wonderful stage.
Thank you. Good
Thank
night,
you.
everyone.
Bye. Bye.